This is my second preferred operation, cervical disc replacement. We rely on this procedure more than endoscopic spine and cervical spine or neck, And this is by removing the original degenerative disc or worn out disc and putting artificial disc where it still allow the movement to happen between the two vertebrae. This technique is called motion preservation technique, where we maintain, after removing the pressure on the spinal cord, maintain good joint space, maintain the movement. Therefore, the patient will not have any significant axial neck pain. Now, this is my preferred option over endoscopic discectomy in the neck or cervical spine because, as I mentioned before, the endoscopic spine technique only resolves the arm pain, doesn't help the neck pain itself. And that's why I feel sometimes not really the best solution. And I believe this is maybe better for some selected patients. Now, this has been ongoing in the market for a very long time. So since 2005, this technique is available and it yields really very good result. And I cannot remember seeing any case for revision or any major complication. Previously, the previous technique in the cervical spine is to remove the disc and put a cage and fuse it with a plate and screws. This technique is still present till now. It is not bad technique, but I always prefer the motion preservation technique because we can allow the patient to move very quickly. Rehabilitation is also quicker, and the patient can leave the hospital virtually on the same day. And more importantly, we don't have to wait for the fusion to happen, which can take 6 to 9 months sometimes, and sometimes it can fail, particularly with people who smoke and with old age where a fusion does not happen, and that will subject the patient for revision surgery, which can be sometimes tedious and not guaranteed to work, and also with some morbidity and complication. Now let me show you this X-rays. This is the X-ray. As you can see, this is the cervical spine or the neck spine. Now you can see this is a vertebra. Between them there is a disc. This is a healthy disc. It's not bad, it's not narrow as this one. As you can see, this is quite narrow. So when we go to the diseased disc, so we can see that, okay, this is a diseased disc. There's some osteophyte in front, there's narrowing in the space. Also, this one you can see it's very narrow. There is like a bridging anterior, bridging posterior, big osteophyte. Again, in this area, the spinal cord passes down to the lower part of the body. So anything coming up from here push on the spinal cord, and this can cause some neurological deficit. So this particular patient had severe neck pain, had arm weakness. He has some imbalance because the spinal cord was irritated, and we have to do 1, 2, and 3 levels according to the MRI scan. There's also pressure here. So this patient needed a 3 levels cervical disc replacement, which is something I don't recommend to do very often. We always do 1 or 2 levels, but in this patient I had to do 3 levels. But thanks God, the operation was very successful, and the patient was very happy. As you can see here, we replace that disc. We take all this disc material, we take the posterior osteophyte here, and you can see here we inserted that disc replacement in here. So this has like minor hooks which get engaged into the vertebra above and below. This is a metal plate and metal plate, and in between there is a plastic piece as well, which is, as you can see it here, the plastic piece which is mobile, and this is like a press fit. So once we put it inside, we close on with the 2 vertebrae, so this would not move ever, okay? Now you can see 1, 2, 3. Imagine that we fuse this one and fuse this one and fuse this one. We definitely will have a problem in the level in between or above or below in the future, and we may have a failure in the procedure itself, because if you are fusing 3 vertebrae, where the load is going to go if you are moving your neck, etc. So this was a perfect solution for somebody who really have 3 levels degenerative disc disease and need a solution for that. So we managed to replace it. Now it is done nearly 2 years ago, maybe less a bit, but the patient is perfectly okay. He's an architect, he's already returned back to work, and he's very happy with the result, with no more neck pain or arm pain or anything else.